Objections, and we were doing a few skits there. Do y'all have a particular objection you would like us to play? Do you have a particular objection that you hear a lot that we haven't already covered? Dr. Davis, can you think of one? Not hearing anybody. Okay. Everybody muted. Is anybody unmuted? We need to hear
Olivia,
somebody.
I think we can hear you on your phone.
I think I'm unmuted now.
Oh,
Okay.
Aubrey.
That's Aubrey. We can hear Aubrey.
Okay, so we're going to use Aubrey's. Okay. Now Aubrey just muted. All right.
I'm unmuted.
Okay.
Everybody else mute your phones except for Aubrey.
Okay. So does anyone have an objection that you would like us to cover?
What do you hear your patients object? What do they say when they object?
It costs too much.
Okay.
She's got me.
No, it's got to be Yana, Ashton, Macy Lynn, or somebody on iPhone. Those four need to hit mute on their phones.
Mine's a drawing.
Where is you mute? Over here.
Where do you hit mute?
Tap your screen, and then there should be a little mute button.
I'm muted because mine says join audio.
Okay, so it's not Yana. It's not Ashton.
Or just turn your volume all the way down, I guess, if you want to try that, if you can't mute.
Okay.
All right, what about
Yeah, it's someone else.
You can also try calling in on your office line on one of those phone numbers that we sent you.
So how about this be the audio and
And if there's any other objection that we haven't covered that you can think of, I know you think it costs too much, that's the money. That goes back to, is it the mask, or is it really the objection, or they just don't want the treatment? So we put that through there. We covered the insurance objection. We covered let me talk to my spouse about it. How about I just need to think about it? Do y'all ever get that one?
Yeah, I just need to think about it. Yes, that's pretty common.
Okay, let's talk about that one. So let's put it through. So you want to think about it. I certainly understand that this is a big decision. Okay, so we're in the validate on page 69. This is a big decision. I can certainly understand you wanting to think about it. Now I'm going to go to 3, clarify. So I'm going to say, most of our patients that want to think about it, they're thinking about 2 or 3 things. They're thinking about, do I really need this? Is this going to hurt? Can I really trust this guy or this lady? Which one of those is it for you?
It's all 3, Paula. It really
It's all
is.
3. Okay.
Yeah.
Well, thank you for sharing that with me, because that's very common. So you're in the big group. You're in the big group with everybody else. So first let's cover, do I really need this? Because, I can certainly understand when it's not hurting. So
Yeah, it's not even bothering me right now, so I don't understand why it's such a big deal.
Remember when we were looking on the camera and the scanner, and you saw how that crack was up there?
Yeah.
And have you ever had a crack on your windshield or crack in your sidewalk?
On my windshield, yeah.
Yeah. So does it just kind of stay still, or does it keep growing?
Well, every time you hit like a big bump or something, then it grows, yeah.
So are you kind of like, wait till the window falls out, or you think you might replace the window before it got to that point?
I usually try to put some tape on it early on and see how long that will buy me, and then it like kind of breaks through, and I realize, okay, I got to go get it fixed and replaced. So yeah, eventually I replace it. Yeah.
So do you know where we are with this tooth? I'm thinking the tape isn't going to work right now.
Oh, Ah, I understand.
We're past
Okay.
the tape.
Okay. And so
Yeah.
what I mean, I can't see it, I can't feel it. What's going to happen if I just let it lie?
Do you like toothaches?
Do I like them? No.
Okay, so if you could avoid pain, would that be an option for you?
Yeah, completely. No pain. I'm a big baby. I get
So,
I
you
get
know-
man colds, so
You mentioned fear. Is this going to hurt?
yeah.
So let's talk about that for a minute. So it sounds like you really want to save the tooth. You want to prevent a toothache. We're already past the duct tape stage. So if there were a way we could make sure it doesn't hurt, maybe you take a nap while we do the treatment, or we numb you before we numb you. Would that make you feel more comfortable?
Yeah, I was just thinking, why would I go through the pain of having him, get me numb with a needle if it's not painful with the tooth? Might as well wait for it to all be painful. You know what I mean?
That makes sense. I think one consideration, I certainly understand where you're coming from with that, with the logic there. One consideration is the length of the time that you're in pain. So the injection takes a few seconds, and we can numb you before we give it to you. And if you're in a toothache situation, doctor might be at a ball game, and it might be a few days. So which risk would you rather take?
Yeah, I see what you're saying. No, I don't want a toothache. I mean, I really don't want to deal with it if it's that bad. I've never had one before. I don't want to have one. So,
Gotcha. You
I
can
get it.
imagine how bad it would be. Like Tylenol wouldn't help. So the last thing you said was, can I really trust this guy? So I can certainly understand that. You're new with us. We haven't done treatment for you before. So one of the things that we could certainly do is have you talk to a couple of other patients who have given permission to have patients talk to them about their experience with us. Would you like to do that, or would you like to see some reviews that have been written about our office, or what?
yeah, I don't really want to bother anybody, take time, but I would love to see some reviews. That would be great.
Okay, I have several here that kind of relate to your situation, so I could pull those up and let you read those. And we just want you to be comfortable. We certainly understand where you're coming from.
Okay. All right.
So if we could show you the reviews, numb you before we numb you, avoid a toothache, is there any reason why we shouldn't move forward? How do you feel about moving forward?
No, I feel better about that. I think that's good. Yeah.
Okay. So that was a triple whammy.
So
Wow.
I want to point out something too. It's called play it forward. When someone has no urgency and they're like, well, it's not bothering me right now, right? You play it forward. And what Paula's alluding to here too is on the cusp of that. If the patient had chosen to go that way, I didn't choose to go that way, but if you play it forward, they say, yeah, it's not bothering me now. I'm just going to hold off. Okay, I get it. So if what you're telling me is if it were bothering you, you'd want to take care of it. Is that what I'm hearing you say? Okay, so clarifying, when you're in pain, you're going to call us to schedule the crown. Is that correct? Okay, I got you. Okay, so I need to clarify something with you, Paula. Once you call us when you're in pain, we'll no longer be recommending simply doing a crown. Instead, before we can ever do the crown, we have to do what's called a root canal. Have you ever heard of that before?
Yeah. Don't like that.
Yeah, that's the only way to remove the pain, is to remove the nerve of the tooth, so there's no pain involved anymore. And we put some filler in there that takes the space of where your nerve was on the middle of your tooth, and then we put the crown over it. So it typically doubles the cost of the treatment plan, and you have to go through pain. That's fine. You can choose to go that route if you want. We can do those for you here in the office. And typically we're doing root canals for people who haven't seen the dentist in a long time, right? So, or you could prevent that and move forward. Which do you lean towards?
Well, I don't want to double the cost, that's for sure, and I definitely don't want a root canal. So, sounds like I just made a decision.
And then usually the next question is, well, when do I absolutely have to do it? When's the last day I have to do this before I got to get it done, right? And then we always say, well, just schedule it the day before it hurts.
So the objection was, I want to think about it. Look how far we went from that. What do we normally say to I want to think about it?
Okay, well, let us know. We agree. Yeah.
Yeah. We'll call you in a couple weeks and see what you do. You know, if we have a 10 on our head and we can just take it a little bit further, we're not trying to be pushy. We're just trying to support them in making a decision. And I just picked 3 out of the 6 objections. Did you see how I did that? I said, it's not hurting, lack of urgency, fear, and trust. I just picked 3. You could pick a different 3. And I'm giving them some options to give me some feedback. And sometimes they'll bite on that. So what do you think? Do y'all like that approach?
Yeah.
Someone said I might want to have a mini version of that.
A mini version of that? Tell me more.
Like,
That was kind of.
I mean, that just seems like something that would have to take place.
Well, it has to. But all this, yeah, most of this is cost.
And then I've done a lot. I've had, schedule, some not, but I just don't see that feels, it doesn't feel that at all. That's just.
It makes her feel awkward, is what she's saying.
Makes her feel awkward. Well, hopefully this isn't the admin team having this conversation. Right? Hopefully this is the clinical person having this conversation. Okay, right, Yana? We want this objection handled before they come to the front.
Okay, because I mean, that's horrible.
Somebody tell me what she said.
It seems like we've been doing that more in the admin department.
Oh, okay. Then that means we need to really practice the system, because that objection right there with the 3 prongs, I don't trust, I'm afraid, and all of that could have been covered in the emotional exam. It could have been covered in the treatment room before we take them up front, because we're asking them how do they feel about moving forward? How do they feel about getting this scheduled in the treatment room? And hopefully that objection would have come up back there. So this is really something the clinical team would be covering. And Yana, if you're getting a lot of that up front, then we need to have a conversation about maybe we need to follow the system. We need to practice a little more in the treatment room. Okay?
Okay.
Make sense? Okay. We've got about an hour and a half left, and we want to get into cancellation.